My name is Dr. Tracy Cormier. I'm a nurse practitioner. I'm very grateful to be here today. I am a startup company called TLC Healthcare Solutions. I've actually been in healthcare for, I hate to say this, close to 30 years. I started off as a paramedic LPN and worked my way forward to get my doctorate degree. So I've seen healthcare at every level, and I basically see it deteriorating in front of my eyes. And I think just about every middle class person is very frustrated with the way healthcare is going. So originally, I created a consulting company for 2 years where I would assist clients who had access to their charts so they would understand. Please come in, welcome. Where they would understand their medical records, because people would read them and not know what anything means. And I had many clients who said, would you be my primary care provider? So that sort of pushed me into this field called, I don't have the clicker, I'm so sorry.
I took the clicker. I'm playing games.
Which one do I click? Just the button here? So I created my company, TLC Healthcare Solutions, for direct primary care. And a lot of people do not know what direct primary care is. So it's more of like an education. I feel like I've been educating people for the last year on this. So there's no insurance. This is a monthly fee. And when you compare the costs, it's a fragment of what people are paying right now. My goal is to not only do this on an individual level, but also on like an employer's level to care for their clients. So basically, as it says here, it's monthly membership, it's unlimited access to the provider, and this is meant to be mobile. So I originally wanted to go to patients' homes. I currently just have a small office space that I'm renting because my friend wanted me to be safe out there in the world until I met my client to know it was okay to go to their place where they live. So, right now primary care providers are seeing anywhere between 1,000 to maybe 3,000 patients a year. So that gives you appointments that are like 7 to 10 minutes. So we're reversing things around, right? So I'm going to get to know you, you're going to be part of my family, I'm going to help you with all your care. This not only includes preventative care, but people are going to harness back their health again. Right now, we're just getting by because people need to take time off from work. They need to, make appointments. Oh, we have to come back another time because we only had 7 minutes to talk today. This is not the reality. This is not what we want as paying citizens, this kind of healthcare. So this is sort of a new wave of, especially here in the Northeast. This is actually very prominent out in California, the Southeast. It's really picking up traction because people are just like, there's got to be a better way for healthcare. And actually, our president actually just signed a bill for the beginning of the year for people to use their HSA accounts to help pay for the membership component of it. So, any questions on the direct primary care?
How many patients will a direct primary care physician provider take?
So it depends. My goal is, I don't want to be too big. I was thinking for myself like 200 to 300 patients, but in reality, I have a vision, which I was going to talk a little bit about, is to create this more on like a mobile, maybe have some sort of mobile unit, so employers would hire me to come to their place of employment so their employees could see me at their facility like once a week. That's sort of my goal, to do that. And the cost benefit from that is like amazing when you look at it on paper. I'm kind of jumping ahead on the slides.
Actually, just keep going with the presentation and
so here we go. Problems, right? The problems with the traditional healthcare. All right. This is my key thing. This is why I wanted you to get my new slide. We're in this upside down triangle. Okay. So these are the people that run the show. And if anyone is here from the insurance company, I apologize. They run the show. They decide who you see. They deny your claims. Profit, profit, profit. The next category is the pharmacists, right? And all those companies. The higher drugs, the restricted formularies. And then where does the provider and the patient come? Way down at the end. We're the ones doing all the work, but the patient isn't benefiting from everything because there's all these barriers that have been put into place by the business model of healthcare. We forgot where we're supposed to be. This should be flipped around. It shouldn't be like this. So that's that. I'm trying to go quick because I know I'm already past my time.
That's fine.
So,
Just come over this way a little bit.
oh, sure,
That's
sure.
right there, it's perfect.
So, again, who do I help? I am here to help individuals. I'm here to help companies. That's my dream goal, is to create this, to be able to go on site to places, people's work establishments, and that to provide that care. There's so many ways to do this. I know you're all gonna have questions, but I feel like that's really the route, and that way people can come see me, maybe, while I'm at their facility for 15, 20 minutes. Basically, I can do the same thing as a regular physician can do in the office. I can do labs, I can do management of all your comorbidities, diabetes, hypertension, hyperlipidemia, all that stuff. So I am here to create a new way of care. That's why I'm here. And I really think this is the trend because, like I said, client, come on in, please sit down. So this is where I'm at. I want to help patients because what's happening now over the last 5 to 10 years is patients don't want to take a day off from work to go see the doctor. They go there and then they don't get any of their questions answered. And people's health is just falling apart. People aren't managing everyday stuff, diabetes, hypertension, high cholesterol, stress, anxiety. People just aren't managing it. They're lost. We're getting sicker and sicker and sicker, especially at earlier ages because the younger generation now is not as active as we used to be, because they're sitting in front of the TV, they're on the computers all the time. A lot of our remote jobs, we're very, we're sitting around, we're not doing anything. So we're seeing the onset of these disease processes at earlier ages now, like even in their early 20s, people with uncontrolled cholesterol. So it's very important. So it's not just like specific age 40 and up. It's really from like late teenager, like we need to be following people and they need to be getting educated, seeing the provider. And there's a lot of this hesitation to go see a provider. Well, I don't want to know what's wrong. Well, you do want to know what's wrong because we're going to keep you out of the hospital. We're going to keep you healthy. Why am I here? I am here because I need help. I need mentorship. I am a healthcare provider. I am not a business person. I have done this all on my own. I have used all my own money. I work an extra day at the hospital just so I could get this up and running and keep it running. I currently have about 20 clients on my membership right now. And it's really nice. They're all within a 20-mile radius of me, but I really want to expand this. I have these visions of things that I want to do, like this mobile clinic. And so I really just need, I'm looking for guidance from the business community, since that's one piece that I am lacking. I don't understand all that. And I'm not going to lie to you, not so great at finances either. But I've done little things. Luckily, my husband's a math teacher, so he helps me a little bit. So that's really why I'm here. I'm here to answer questions about what this new model is of care, and also how you guys can help me grow as a provider to make this really what I feel like it's really gonna take off soon. I can feel it, like within the next year or two. So what questions does anybody have?
Aiden, do you have the other mic? This need the mic? Oh, we're gonna just forget about that for now? That's fine.
Hi.
Just speak up if you would, and go ahead.
No worries. I can project my voice. Thank you for sharing this information. And I do see it across the country, especially that there's a huge transition with the shift in the jobs and the layoffs, etc. Not a lot of people can afford the healthcare, like insurance healthcare, for example. So, few questions I have. And
Okay.
I'll share the floor with everybody else. Is this replacing insurance or augmenting insurance?
So this is augmenting. I crunched some numbers to see where we're at. I actually have a friend who's in the healthcare insurance field, and he's been very helpful. He kind of gave me like a lot more information, and most employers are spending anywhere between $500 and maybe $2,000 a month for each employee for their healthcare. And this would save them a lot more than that. Yes, you would still need other insurance, like accidental, hospitalization. You would still need that other, like catastrophic. This would replace the primary care portion of it, the preventative health portion of it.
And how, outside of companies, like especially you're talking with a lot of entrepreneurs and people who might not have insurance,
Yeah.
how does that work in adjacent of like COBRA or maybe replacing like the traditional model of insurance of adding this plus accidental or hospitalization insurance? Is that, do you have like numbers around that?
I don't. So I can tell you right now, I do have 2 people that are uninsured, and they pay me monthly for it, and I do give them, I give everyone like a super bill for people who do have insurance, so they can use this as part of their deductible. So that's what a lot my other clients are using. So every time I see them, I talk to them over the phone, I send them a super bill, and then they're able to put this towards their current deductibles. So that's what some of my other clients are doing, and like I said, I do have the 2 people who are uninsured, and they just pay me monthly, and I usually, most of them I talk on the phone, but my requirement is I have to see you in person at least once every 6 months. That's my requirement.
And have you explored also, so there's this trend of replacing insurance by like solo insurance, especially for people who are not employed. There's a new trend, or I'm not sure what the model is called, but it's a different type of insurance that covers a lot of things, but doesn't cover maybe the piece that you're covering.
Right. So this is not, because this is a cash, basically. This is not insurance. So the only thing that's new is using HSA accounts for this. But if my friend's a travel nurse, so she has the kind of insurance that you're talking about. And I still give her a bill every month, and she sends that to her insurance as part of her deductible. So I'm hoping as things change, that may change and evolve as, you know, we're moving. This was just a big step this past year, being able to use HSAs as part of the membership. And when you look at, like, what does the membership, right? So they range anywhere from all over the country, anywhere between, like, it's going up, so I want to say it's like 75 to like 150 a person. But compared to what people are paying right now, and that includes like basic lab work, you know, collaboration of care, getting with the specialist, seeing, you know, talking over the phone, helping you understand your medication. I mean, this is much more involved than your, you know, 5-minute visit.
Okay. I have more questions, but
Hi.
everyone has questions.
Can you walk us through what the actual business model is here? Like what is it that what is it, so I get you're replacing primary care, but what's the, I see the society benefit you're trying to solve, but what, on the ground, what's actually happening? And like, do you think there's savings in terms of money, or do you think the benefit is better outcomes?
Both. There's savings and outcomes. And I'm actually trying to collect data on, like I said, I don't have a big panel because I've just started, but I am trying to, I put like key performance indicators basically on the different types of you know, pathologies, hypertension, hyperlipidemia, and what close monitoring really does show. So I am trying to track some data for that through my EMR. It's not the best EMR, but I'm trying to, again, I'm evolving as things change here. I don't know if that answered your question or not.
That's okay. Are you aware of, like, what would the most like what you're trying to do that already exists be?
So it's really a new model. There are a couple direct primary care providers, which we discussed. There's one in South Windsor that he's been doing this for about 5 to 6 years, and he's really seeing things start to take off now. I do think this is going to be the wave of the future for people, just because of the way our healthcare is right now, and most of us are frustrated with it, not getting what we need. And this, in the long term, to be healthier, to live longer, just to have a better relationship with your provider, I think is really important for a lot of people. Whoever.
Great.
I know. I think you were next.
So, going back to the number of patients you take on, How do you reconcile that with taking on corporate customers that might have 200 or 300 people in these corporations?
Right, so-
How do you scale for that?
Right, so this is the thing. I need to learn how to, this is why I'm starting at the bottom, and my goal is to scale. Like if I can bring this forward, bring other nurse practitioners or other physicians onto this. This is my goal. And I don't really have a plan for that yet, but that's my future plans. I'm just trying to create a really good foundation for myself. I found that if I can do that, there's pieces that I'm definitely missing because again, I don't understand the business world that well. And just getting my name out there, it's been really difficult in regards to costs and advertising and all this, and I don't know what the right way is to advertise. So it's been very difficult. So I appreciate you having me here.
Well, I would put it out to escape velocity. Her stage, what should she be focusing on?
Well, I mean, I do just have a question. So, I mean, first of all, this is definitely needed. I mean, it's mid-February and I've already hit my out of pocket. It's necessary. I was bitching about insurance this morning. Come on.
Hey.
But, I think the model that I closely see this resembling is a collective. So I'm not sure if you're familiar with those types of kind of insurance, augmented insurance programs. It's essentially the same idea. It's a membership-based. It's a cooperative, you can call it.
Yeah.
Everyone pays into it every month, say 150, 200. I don't know what it is. Don't quote me on that. And then as insurance needs come up, the cooperative, they would negotiate essentially with the care providers and get a self-pay reduced bill, and then they would cover that bill for the patient. So I think with my question is, what is the benefit of this specifically for the primary care only versus that model?
So again, expanding my plan is to have relationships with pharmacies for better pricing. I already have relationships with labs that is a quarter of the cost that you would pay to have labs go through your insurance. A primary example would be a cholesterol panel. I just had one done. Out-of-pocket cost for me was about $500-600. I did a full panel of blood work, including that with an extended profile for $120, cash based. So there are benefits to it. It's a matter of me creating relationships with these companies. Like I said, I do have the labs right now. I've reached out to a few of the imaging places, but they're really not. They'll give you probably about a 25-30% deduction for imaging if you pay cash out of pocket, but they're not. I was hoping there would be something a little bit better.
Well, go ahead, you were first.
I guess, so just so I understand the experience of your current clients, you said you have 18 or so that are currently insured?
Yep.
And so then on top of that, they're also paying for the subscription?
They are, because they've been frustrated with the care that they received. And I have many people who said I've had 3 to 4 primary care providers in the last year to 2 years, because primary care, they don't stay. They have to see 30 to 40 patients a day. They're burnt out. And nobody can find good providers anymore, and especially when you have multiple illnesses and you really need somebody to take that on and work with you, they're seeking other ways to get better health.
So in that, just following on that, in that case, those folks are having the premium on top of their insurance, just getting that better quality of care? Is that the model you're going to continue, or just pursue something more like a co-op or uninsured clients?
I have to look more into the co-op. I don't really understand that, to be honest with you. I know it does exist out there. Again, my goal is to create relationships. And like I said, I've been doing this for 30 years, and I just see where all the gaps are, and I see where the pure frustration is in healthcare. And I want to spend time. I want to help people understand why we're doing this, and not just be like, yeah, you're fine. Well, you got a little anxiety, you're fine. No, we're going to talk about things. We're going to find the right solutions for you.
This sounds a lot like a boutique type model. I would obsess over your model. Like, what is it that makes it unique?
So I guess you can. Some people call it concierge.
Yeah, concierge.
Right. So. But
But
concierge is different. Concierge is you pay, I think what somebody was talking about earlier, you pay the membership, but you still use your insurance. So they're still billing you So that's the difference. I am not billing for any of the insurances.
Healthcare, nurse practitioners you mentioned then, so now there's a parallel universe happening there as well, isn't it? From my understanding, nurse practitioners are trying to shift the center of gravity from the hospital towards that home, and so now the doctors are also breaking rank in that regard?
Yeah, so nurse practitioners were really always community-based driven to fill the gap, right? And there's, again, I think as nurse practitioners, physicians assistants, as those numbers are growing, again, it depends on what your specialties are, right, too. But there's less MDs or DOs going into internal medicine because of everything that I just told you. The high demand, the patients that you need to see, all the charting that needs to go with it. Now that AI is here to help with charting, I think we're gonna see developments and that will get a little easier for providers. But I really feel like nurse practitioners look at the whole picture. And again, like what I said earlier, is I've worked at every level, so I understand every level of care and how I can make your health better.
Would you hire nurse practitioners, or would
Yes.
you hire more people like yourself?
Yeah, so I am a nurse practitioner. Yep, I am. I'm a nurse practitioner. I have my doctorate degree. I have so many initials that my husband told me I had alphabet soup. But, and I actually specialize in cardiology. That's really what I've been doing. I was a director of cardiology. I helped grow a cardiology practice out in the rural Northeast Territory, building the office, the inpatient setting, and when I was out there, I really saw the need for this because I was housed out of a family medicine office, and these doctors and nurse practitioners, they were just overloaded every day.
Well, so, I mean, I guess this is where, maybe kind of, there's a crazy thought, but if you think about the value chain, the entire supply chain, it seems to be a very high cost part is the digital, the equipment, the testing. So maybe that's the part that the collective needs to invest into, so you can get, in a less expensive usage, so that you can control the pricing.
Exactly. Yes.
So maybe there's an investment that happens in that machine. The doctor came up on TV the other day saying that we only really scan at the extreme end when it's almost too late. Why don't we scan earlier? So you get more usage out of it, cheaper flow, more volume, economies of scale.
Yeah.
So it's like set up a manufacturing operation in terms of like medical equipment, or centralize it.
Yep.
Connect I wonder if there's a way to connect all the existing machines that are not being utilized now, and have a network that that utilizes the existing capability.
I think coming into the future, I think that's going to be a new wave just because of the way hospitals are so overbooked with getting tests. I mean, a lot of places they're booked 2 to 3 months minimum for certain tests that you're looking to get. So that's like another, I think, part of this.
They charge $600 to your $120. That's kind of differential.
In regards to
Usage of this equipment, the hospitals charge a lot more money.
yes, because they're going through the insurance, and the insurance is taking a bulk of that. And even still with the high most people I know, their copays for the year are between $5,000 and $10,000, including what, like my husband's a teacher, he's paying I think $2,000 a month for the family. So, and then you're adding another $10,000, and people don't want to go to the doctor because they can't afford to even pay their copays. That's the problem.
Yeah.
So.
I think one question I have you seen a specific group of people that are drawn to this more, or is it, middle age, is it elderly, birth to early childhood?
So it's been more people like 35 and older. So I still work full-time at a local hospital here, and people look me up. And then they see, and then they have questions. I try, it's very difficult. I have to be like, I can't talk about that in this vicinity, but I'm finding that the pure frustration of the clients is why they're looking to find something different. And that's really what's happening. There's just people that are done with the current system and they want something better, as we talked about earlier when I first came in.
Is there a network of specialists and subspecialists that are willing to do a modified version of direct specialty?
So I'm going to be honest with you, I'm quite surprised no one has done that yet. As part of my advertising, because I am certified in a lot of from the American College of Cardiology, that is my wheelhouse. Like complex patients is my wheelhouse, and that's kind of my selling point also. Is that I am used to dealing with where primary care would be like, okay, you got to go see the cardiologist, the pulmonologist, the kidney doctor, where a lot of this, because of my education level, I'm able to deal and take care of a lot of this, and because I have such a great network since I've been living in Connecticut my whole life, I know who to send people to. They have to then use their insurance though, and to get appointments with a specialist is currently 6 months to a year.
So, but as an example, I know of a neurosurgeon who several years ago we talked about renting time in the surgery center, doing the surgeries at a cash basis, because it was far less expensive, and even sometimes deductibles on the insurance policies. And that was going to be his future model. He's since retired.
Yeah.
But the concept of doing specialty and subspecialty care at a discounted rate outside of the insurance, because
Yes.
what they get paid cents in the dollar
Yes.
for their surgeries.
Yes.
So, if somebody came to me and said, I'll pay you that same amount in cash.
I see this coming in the future, what you're saying. And I would love to somehow, I guess this collaborative, right, of all us sort of direct cash type of thing to make it easier for people. And I mean, if you need surgery, you're waiting weeks to months to get surgery at this point in time.
Just a suggestion, I'm starting establishing those networks now. You're specialized in cardiology, so finding someone who can do the echoes in your office and having a radiologist outside interpret would be helpful.
Yes.
And somebody who can do nuclear medicine testing at a discounted rate. Even in the world that I live in,
Yeah.
MRIs that we can get 2 for $700.
Yeah. I'm trying to find those connections. They're very difficult without going through like one of the bigger main establishments here, because everyone's being bought up.
Yeah.
So that's part of the
There are
problem.
independents out there that want to stay independent. I was just reading Becker's yesterday and about how a lot of, again, surgeons are looking to stay independent of private equity, independent of hospital buyouts.
Yeah. I would love to get into like a group with specialty all housed with this concept. That's my goal, along with trying to go to employers. Yes?
Excuse me, I was a little bit late, so I'm sorry.
That's okay.
I'm trying to understand how will your program benefit someone like me who is, has limited funds? What would I get from the subscription, from your subscription? What would
So-
benefit me also?
So, I mean, if you're an individual, I guess, who has multiple disease processes, diabetes, hypertension, hyperlipidemia, you would benefit seeing a provider and having them monitor you, have them educate you, trying to create a new lifestyle for you, working together with you to improve your disease processes. Because I can't tell you how many people, like I specialize also in sleep apnea. There's so many people out there with sleep apnea, and I finally actually have a relationship with a company that can do in-home testing for that at a fraction of the cost compared to what is billed through your insurance. The cost right now between my consult and that, it's $450 out of pocket for a person, and they bill like almost $4,000 to your insurance for that.
Okay, thank you, Tracy.
Okay,
very much.
thank you, everybody.